Hi, my name is Kaya. I'll be your nurse today. How are you?
Good, how are you?
Good. Can I get your name and date of birth?
Claire Maley, 6/16/83.
Perfect. Okay, Claire, so today we'll be performing a musculoskeletal assessment. So I'll have you getting up at some point and I'll be touching you if that's okay, and we'll kind of do a series of questions and things like that. Okay, so we're going to start with some history. So do you ever have, or have you had any stiffness, limited motion, any swelling or heat of the joints?
Yeah, I had trigger finger in both of my hands and adhesive capsulitis in my right shoulder.
Okay, do you remember the dates of those surgeries?
Oh, yeah, I had surgery on both of them. My shoulder surgery was October of 2021, and my finger surgeries, they did them at the same time, were May of 2018.
Okay, perfect. Do you have any pain in your muscles or bone pain?
No.
Okay. If she were to say yes, I would do an OCART assessment just to see what the goings of that is about. So we talked a little bit about your surgery. Did the surgery go well? Do you feel like you're still able to do motion of your muscles?
Yeah, I have almost full range of motion in my hands, the back of my shoulder. I probably have 70 to 75% range of motion back.
Okay. Do you do any like physical therapy for that or anything?
No, I did for over a year.
Okay. Cool. Thanks for sharing. So let's talk a little bit about your medications. So do you have any past medications or current medications that are for anything with the musculoskeletal system?
Yeah, they had me on an anti-inflammatory medication for my shoulder and tramadol until I had surgery, and then I was on some pain medicine for after surgery, and then they stopped everything. So I'm not currently on anything.
Okay, perfect. Thanks for sharing. And if she would need assistance, I do have a list of medications that she could possibly take in for musculoskeletal system. Have you ever had a bone density test?
No.
Have you had menopause yet?
No.
No hot flashes yet? Do you have a calcium deficiency?
No.
Okay, no. So we're going to talk a little bit about your functional assessments. Are you able to do your daily activities, feeling safe at home, don't need assistance with anything?
Yeah.
Okay, perfect. All right, so we're going to get started with a little bit of some family history, so more questions. Has your family had a history of anything with musculoskeletal related? So maybe gout, osteoporosis, rheumatoid arthritis?
No.
Okay, no. Do you have any or have experienced rheumatoid arthritis, osteoporosis, or gout?
No.
No. Okay, perfect. Let's talk about your lifestyle. Do you exercise?
Yes.
Yes. What do you do for exercise?
I walk.
Okay, you walk. That's good.
And I have a 2-year-old.
2-year-olds are probably chasing him around all the time, huh? Yeah. Do you smoke or use tobacco?
No.
No. Okay. Do you drink alcohol?
Once every 3 months.
Okay, once every 3 months.
So no, basically.
No, basically. Okay. Special occasions. How's your posture? What do you do during the day, and how do you generally feel like your posture is?
I think that sometimes throughout the day I can end up slouching a little bit, but I try to make sure that I am sitting straight up because it really affects my shoulder if I'm not.
Okay, perfect. Okay, so now we're going to get into the inspection and palpation of things. Like I said earlier, if you feel uncomfortable at any point, let me know, and I will stop or just try to find something different for you to do. And you'll also be doing some exercise for me, so kind of getting active so I can see how the things are working in your musculoskeletal system. Okay? All right, so we're going to start with you standing up. So the not the xiphoid process, the spinous process. So yeah, perfect. Stand towards me. So I'm gonna check for swelling, redness, any deformities, contractions, muscle atrophy, and all that good stuff. So as I'm looking at the spine, it looks symmetrical. I don't see any sign of scoliosis, psychosis, or lordosis. I also see that everything, like I said again, is symmetry. I'm also going to start palpating and looking for at the top of the spine, so kind of feeling any abnormalities. Again, looks like the skin is warm and intact too. I don't see any redness, so we usually should have 7 here. And then we would go down to the lumbar, so that would be the thoracic, so that would be 12. And then we would go down 5 to the lumbar, and then of course the sacral, which would be about 5, and then the 3 to 4 coccygeal, which I'm not going to go further. Okay, Claire, so if you want to turn towards me, we're going to do some exercise, like I said, so some flexion, hyperflexion, all that good stuff. So if you want, we're going to start with you standing up, which you are. So can you touch your feet?
Mm-hmm.
So of course I'm assessing, looking at the spine. And then can you lean side to side? Perfect. Okay, can you keep your hips in place but move side to side? Perfect. Okay, and then I'll have you sit down, and I'll make sure my bed's pretty low for me. And then we're going to do some assessments of your head too. So what you're going to do is you're going to move your head side to side, but I'm going to see for resistance. So go on this side. And then you move your head back. Perfect. And then forward. Perfect. Okay, so now we're going to check some TMJ. So as I'm assessing and inspecting the TMJ area, there doesn't look like there's any redness, disformities, or anything that's abnormal for the patient. Okay, so I'm going to put my hands, I'm going to touch you, I'm warming up a little bit because my hands are a little bit cold. And I'm going to have you move your mouth up and down. I'm also checking for crepitus. So go open. Perfect. Perfect. All right. So can you also move your mouth up and down, so that vertically and laterally? Perfect. Everything looks good. And then I'm also going to have you come forward and backwards. Perfect. It's kind of hard to do, I know. It's kind of a difficult one. So protraction and retraction. So everything looks good for the TMJ. So now we're going to move on to your shoulders. So I'm going to look at the joints of your shoulders and check for warm. Just going to warm my hands a little bit. See if it's warm. See if there's any disformities. Looks like the I think it's the Amicron process is fine. There's range in the shoulder. And then for inspection, I really would just look at the shoulder and not do any touching. And for palpating, I would kind of touch and see what is going on. And then I would have her do range of motion instead of doing it myself. So now we're going to have you do some things. So I'm going to have you move your arms up and down, forward and up. So up and down, forward and then down. And then I'm going to have you swing your arms back and forth. So if you want to, you can stand up so it's easier. Swing your arms back and forth. Perfect. And now I'm going to have you put your hands behind your back.
I can only do it with one.
Oh yeah, you can only do it with one hand because of the surgery. Okay, perfect. And then also, can I have you move your arms upward?
Mm-hmm.
And then can I also have you move your arms backwards?
Mm-hmm.
Perfect. And then can I have you touch your hands behind your head? Mm-hmm. Okay, you're able to do it. And then put your arms behind your back. Okay, and then we already did that because you said for your surgery. Perfect. Okay, so now I'm going to check. So we're going to do some shoulder shrugging and depression. So I'm going to see how many shoulders up, down, shoulders up, and down. Okay, can you flex your arms? I want to see your muscles. Okay, perfect. And then can you push down too? Perfect. All right, so now that we did that, I'm going to start with the inspection of your elbow. So if you want to, you can sit back down. So I'm inspecting the elbow. I don't see any disformities or anything that's abnormal. The color looks fine. And now I'm going to start with the palpation. So I'm going to look at the oleocrine process, the lateral and medial epicondyles. So I'm going to touch and see everything looks good. So now I'm going to have you do some range of motion. So if you want to, we're going to have you straighten your elbow and then move it back forward. Then I'll have you stand up because this one might be easier. So you're going to see how far you can bring your elbows back. Okay. And then now we're going to see with your hands, we're going to do some supine and prone flexion. So you're gonna go up like this, and then like this. Okay, perfect. And I'm looking at the elbows to see if there's anything that's abnormal or not functioning perfect. Perfect. Okay, and then we're gonna do your inspect and palpate your wrist and fingers. So you can sit back down for this one if you want to. Sorry, I have you up and down so much. Okay, so what you're gonna do with your hands, you're gonna put it on like this. Let me see this, and then do the other side. Perfect. And then you're gonna put your hand down. So I'm looking at radial and ulnar sides, so that looks good. And then also I'm going to have you get your wrist forward and backwards. Perfect. Everything looks good. And then we're going to have you spread your fingers out. Perfect. And then you're going to make a fist for both hands. Perfect. Everything looks good. Okay. And now I'm going to have you do the opposite of your thumb. So it's kind of like a little, not a game, but you kind of are going to take each finger and make sure you touch each one of your fingers with your thumb though. So like this.
Mm-hmm.
Then you're going to go backwards. And you're going to do it with the other finger. And then you're going to go backwards. Perfect. Okay, can I see it again?
Mm-hmm.
Wow. Very good job. Okay, so now we're going to do the hip and knee. So you stand up again. This, I'm looking at the symmetry of the iliac crust and then the gluteal fold, so which is in the back. So everything looks symmetrical. Okay, so we're kind of going to do some exercises like track. So what I'm going to do is you're going to have you put your leg in the air.
Over forward.
Forward.
Okay.
Yes, and then put your other leg in the air. Forward. Perfect. And then I'm going to have you stick your leg out. Perfect. And the other leg out. Perfect. And then I'm going to have you duct in and then out. Perfect. And then do the other one. In and out. Perfect. And now I'm going to do stuff with your knee. So at this point, you can sit in the bed, and then I'll start having you moving your knee up, and I'll show you kind of explain.
Do you want me to lay back?
Yeah, lay back a little bit. And I'll explain what we're going to do, because this should be at a supine position.
Okay.
Okay, perfect. So what I'll have to do is I'll have you lift your leg up. Perfect. And then lift your other leg up. Perfect. And then I'll have you bring your knee to your chest. Perfect. And then bring your knee to your other knee to your chest. Perfect. Okay. And now we'll, after we did that, it's perfect. I'm also going to be looking at the hips at a different angle too, so that way you're really making sure. And this, I really should lift that up so it's at a working level too. But everything looks good with the hips. Okay, Claire, now you can sit up. I'll sit you up if you want to, so you don't have to. Okay, so now we're going to inspect and palpate the toes. So we're going to look at the articulation of the femur and the tibia and the patella. So I'm going to also look for tender and swelling here. So I'm going to inspect. Everything looks to be on average. The color looks good and there's no swelling or tenderness there. So now I'm going to start with having you dorsal flex and extend. So I'm going to look to the bed a little bit so that way I'm able to see. You're doing a great job.
Thanks.
Okay, so I'm going to have you bring your toes up to your nose. Perfect. And then your toes down. Perfect. And then I'm going to have you inverse and exverse. So there you go. Turn your toes in and out. Perfect. And then now I will check for any warmness and palpate the inside of your toes. So I'm going to check for warmness. Perfect. Okay, now this completes the musculoskeletal assessment.